So what are the 10 things that you should not say to your doctor? So there are certain things that you really should not be saying to your doctor, because your doctor will be looking at you like, seriously? So let's start with, doctor, I've got an infection, I need antibiotics. Well, basically, your doctor is actually the one that will tell you what you need. So you might have an infection, but that does not mean that you need antibiotics. There are two types of infection. There's viral and there's bacterial. A viral infection does not need antibiotics. A bacterial infection needs antibiotics, but your doctor is the one that's going to tell you that, not you telling the doctor you need that. Okay? It's like you going to the mechanic and telling the mechanic, oh, my car needs more oil. Surely your mechanic knows that, right? But he wants to be the one to tell you that. Now, the second thing is basically the doctor, you've seen the doctor for the consultation. The doctor has come up with a management plan and has told you, like 5 or 6 different ways of managing the problem. And as you're leaving, you say, is that all, doc? The doctor has just spent a good 10 minutes explaining, what you need to do to remedy the problem. And you stand up saying, oh, thank you, is that all, doc? I mean, how much more can the doctor do? How much more do you want? The doctor has given you a shopping list. So that's the second thing, asking, is that all, doc? Now, the third thing is when you've been saying, I have just saved a shopping list for you. No doctor wants to hear that, especially in the UK where we have like 10-minute appointments and the pressure is on. And we're trying to stick to one problem per appointment. And you've come to tell the doctor, I've got a shopping list, as if you're doing the doctor a favor. No doctor wants to handle a shopping list, especially when you've come up with the most vague problems ever. Oh, I've got this numbness in my thigh, I don't know what it is. Or I've got this headache. Or I've got this chest pain. I've got this fatigue. I mean, fair enough. I mean, all those problems could all be actually, like, for example, you could have 10 different symptoms. It could be menopause. But there are times that you've had 10 different symptoms and it just doesn't fit into the inbox. It just doesn't make sense. So saying that, doctor, I've come up with a shopping list is of no pleasure to the doctor. It might be good for you because you can tick off the shopping list. But for the doctor, you've got sweats dropping down your head thinking, this is going to be a long consultation. I'm going to be running behind. I'm going to be running late. I've got angry patients in the waiting room. What can I do? And now the fourth one is when a patient comes in and say, you look too young to be a doctor. I mean, there are two ways you can take that. You can either take that as a compliment, or it could be that the patient does not believe in your ability. The patient might think that you're not experienced enough to deal with the problem that they've come with. So I can either take that as a compliment or take it as the other, But, in most cases, as we know, the patient is looking at you. If you haven't got a long grey beard, you haven't got glasses or maybe a suit, they're thinking you're too young to be a doctor. As in, you might not actually know how to deal with this problem. So try not to come with those statements of you look too young to be a doctor. Now the sixth one, which is something that I get commonly as a male doctor, which really irks me up, especially with men, is when they come in and they say, hello mate, not even hello doctor, hello mate. I'm like, are we mates? Do I know you from somewhere? Do we go to the pub together? Do we play football together? How did we become mates after like 5 seconds? I'm talking about even men that are like 20 years younger than me. I mean, I'm not going to tell you how old I am, but men that are like half my age are like, hello mate. And I had this chap, 18 years old, was quite older than him, and he came and was like, well, this mate, that mate, this mate. I'm like, listen, mate, we're not mates. You address me as doctor, and I'll address you as whoever you need to be addressed as, which is your name. But do not call me mate. And he wasn't happy with that. But I'm like, we're not mates. Why would you call me mate? I worked hard for this. I went to medical school for quite a number of years. Call me doctor. That's my title. When at the door, it doesn't say mate so and so. It says doctor. So mate is not my title. Mate is not my degree. Don't call me mate. Hello doctor, not hello mate. And for the women, I've been told that the women sometimes they get called, what do they get called again? Is it hello? They don't get like getting called miss, hello miss. They're doctors as well. Don't call me hello miss, call me doctor, same thing. Now the sixth one is when the patient goes, you tell me, you're the doctor. So let me put a scenario for you. It could be that a patient has come in with, let's say, back pain, okay? And the doctor is asking, so what do you think caused your back pain? That is a simple, honest question, because you could reply back and say, oh, actually, I've been doing a lot of gardening work, or I've been lifting some, heavy items, I've been moving house. But in some cases, the patient will just return a reply and say something like, you tell me, you're the doctor. I mean, I wasn't there, was I, when you had a back pain? So I have to ask. I don't know what you've been doing for the last week or two. So of course I have to ask what you think caused the back pain. Of course I know I'm the doctor. You don't have to tell me that I'm the doctor. I already know that I'm the doctor. I'm just asking a simple, honest question. What do you think caused your back pain? Just say you don't know. Don't come back and say, you tell me, you're the doctor. So again, that doesn't help the doctor-patient relationship, because the doctor can be like, okay, you know what, I'm not really going to help you as much as I was going to help you just now, because you're just being so anal, so just bear that in mind. Doctors are asking you a question. Don't come back and say, you told me, you're the doctor. We already know we're the doctors. We're just asking you what you think caused it, because then we can help, that gives us a clue as to what we need to do next. Or if it's something that doesn't make sense, we can say, no, we don't think that's the cause. So just be a bit more sensible with your replies. Now, the seventh one is when the patient goes, I've had this problem for a while now. So this usually happens when the doctor is asking you the questions at the beginning. You've come in with, let's say you've come in with a cough. And the doctor said, okay, how long have you had this cough for? Oh, doctor, I've had this for a while now. Okay, for a while. What does that mean, for a while now? Is that 6 months? Is that 2 weeks? Is that 3 weeks? Is that 2 years? For a while now is very vague. Come on now. So I had a scenario where the patient said for a while now, and I said, what does that mean? Like, what does for a while now mean? And the patient said 5 days. Seriously? So 5 days, and you've had this cough for 5 days, and it's for a while now. Then I've had another patient who's told me, oh yeah, I've had it for 5 months. So why not just say that in the first place? Look, before you come into the doctor's office, why not just think about your story and try and get your story together? You've been to see doctors before. Try and anticipate what questions the doctor's going to ask. Is the doctor going to ask about my cough, how long I've had it for? Okay, we're in September now. I had this cough in May. So May, June, July, August. So that would make it about 5 months. Just try and be a bit less vague, because help the doctor out, because it makes a big difference. If you tell me you've had this cough for 5 months, I'll be like, I'm sending you for a chest x-ray. If you tell me you've had it for 2 or 3 weeks, then obviously I don't need to do a chest x-ray, depending on if you don't have any other worrying signs or symptoms. So please, be specific. I've had this problem for 2 months. No, I've had this problem for a while now. That doesn't mean anything. It might mean something to you, but it doesn't mean nothing to me. I'm not a sidekick. Now the 8th point is, but Dr. X always gives it to me. Why can you not do the same? So this could be like an antibiotic. Maybe you come in for a simple cold, and the doctor you see is always giving you antibiotics for a cold that usually goes within 5 to 7 days. And I'm like, well, I don't think you need an antibiotic. This is just a cold caused by a virus that's going to go away on its own. Take some honey, ginger and lemon, wrap up warm fluids, and it will go. If it doesn't go, then come back and see me again. But no, they want an antibiotic because Dr. X always gives them an antibiotic for their cold. And they go into that kind of emotional blackmail. Dr. X always gives it to me. Why can you not do the same? I cannot do the same because I am not Dr. X. Can't you see that? I am not Dr. X. That's why I cannot do the same. I'm going to manage the problem as I see fit. If you want Dr. X to give you what he always gives you, he or she always gives you, then go and see Dr. X. Or you've seen Dr. P. Dr. P ain't going to give you something that you don't need. Then number 9. Are you sure that this is what I've got? Okay, so you've come in with something. Let's say you've come in with a rash. And I look at the rash and I'm like, yes, I've seen this rash so many times. This is a viral rash called pityriasis rosea. I've gone into the computer and I've shown you the pictures of pityriasis rosea, and you can see that it looks almost exactly like the rash. And I've told you, I've seen this 100 of times, pattern recognition, I've managed this, I've dealt with this before. And after like 10 minutes of rambling, are you sure that this is what I've got? I'm like, am I sure? I mean, I've just spent 10 minutes talking to you about one condition. I never thought about anything else. I've shown you pictures on the computer. online which actually match similar pictures, and then you're asking, am I sure that's what you've got? Actually, maybe I'm not sure. Maybe you want to see someone else then instead? Now the 10th but the last bit is, doctor, I went on Google and it said I've got cancer. Okay, so a doctor comes in, a patient comes in and basically they've got symptoms. Maybe they've got headaches, they might have other symptoms such as nausea, dizzy spells, and you type in those words in Google and maybe it says about like a brain tumor or brain cancer, and then you've come in and that's the first thing that you've mentioned. Oh doctor, I went on Google, I typed in my symptoms and it said brain cancer. Doctors don't like it when you go on Google because Google has got all sorts of stuff, all sorts of misinformation on Google. We usually give you recommended websites to go to, like, NHS patients, NHS for patients, doctors.net for patients, all this like verified websites where it doesn't mention cancer all the time. Patient.co.uk is a good website. So when you Google your symptoms, it's most likely going to come up with something, quite sinister. But bear in mind that there's 6 billion people on this planet. So if there's 3 million typing the same symptoms, I'm pretty sure not all 3 million people have that exact same diagnosis. The problem is Google cannot ask you specific questions to find out what exactly is the problem. Google cannot ask you, when did the headache start? Google cannot ask you, where is the headache? Google cannot ask you, do you have any other symptoms? But I know now they've got all this AI stuff, this artificial intelligence that's maybe more specific and can hopefully narrow down your differential diagnosis down to other possibilities, such as maybe having a migraine, or maybe you had a cold or stress, viral infection that could cause the symptoms, and the brain tumor will be pretty much bottom of the list because you do not have any red flags that indicate you've got a brain tumor. So stop going on, Google is good because Google helps you to be informed, but go and find the right websites to go to rather than just typing in your symptoms. And the first thing you want to think about is cancer. Okay, so just bear that in mind. Don't come to your doctor and tell your doctor you went to Google, especially when your doctor has, spoken to you and told you, oh, I think it might be a migraine. And then you counteract that with, I went to Google and said it's cancer. Well, doctor, what do you think? Well, I wasn't thinking cancer, which is why I never mentioned cancer. So these are the 10 things that you should not say to your doctor. I hope you bear that in mind. And if you can, try not to say all these things, you would have a good doctor-patient relationship.